For those of us just joining on the recording, hello again and welcome to Age-Friendly Communities Research to Action Summit, hosted by the Hub for Aging Collaboration at the Rutgers School of Social Work. It is my pleasure now to introduce Dr. Emily Greenfield, professor at the Rutgers School of Social Work and director of the Hub for Aging Collaboration, for welcoming remarks.
Hello, everyone, and welcome. We're so glad for you to join us today. My name is Emily Greenfield. I'm a professor of social work at Rutgers State University of New Jersey and also the director of our Hub for Aging Collaboration. And I just want to note that today's summit is happening on Friday, May 1st, 2026, which holds special significance in the field of aging in the United States, given that it is the start of Older Americans Month. It's an annual observance held every May in the United States dedicated to recognizing and celebrating the contributions of older adults to their communities and to our nation. More specifically, the purpose of today's event is to feature cutting-edge research on age-friendly communities from across the U.S., hoping to illuminate insights for social change and to strengthen the age-friendly movement broadly. Before diving into our fantastic content, I want to offer a few notes of background to contextualize our time together today. Next slide. So greetings from our Hub for Aging Collaboration at Rutgers, the State University of New Jersey. Our hub operates as part of the Rutgers School of Social Work at Rutgers, New Brunswick. The broad aim of the hub is to advance excellence in research, teaching, engagement, and leadership to collaboratively improve social contexts for aging and health equity. Of note, the name of our hub includes both aging and collaboration, and consistent with our emphasis on collaboration, we are so grateful to have the infrastructure to host and convene today's virtual summit, which brings together leading research teams from across the United States that are advancing cutting-edge work on age-friendly communities with an emphasis on better understanding and guiding local implementation processes. Next slide. So as this slide demonstrates, we first will have researchers from Ohio State University present on their innovative work about the role of statewide mobility managers. Next, we have researchers from Penn State and Cornell who will present empirical findings on the state of progress for municipal planning on aging. Third, our team at the Rutgers Hub will present on older adult strengths as age-friendly leaders. And finally, we'll have experts from the University of Massachusetts Boston present on the development of a spillover effect assessment tool for age-friendly communities. But wait, there's more! Bill Armbruster, the steadfast leader of the AARP network of age-friendly states and communities, will moderate discussion after all of our presentations, followed by brief closing remarks, and then we'll give all attendees the option to enter into individual breakout rooms with each of the speakers for more in-depth conversation as time allows. And of course, a virtual event wouldn't be anything without our fantastic group of attendees and participants. I want to thank everybody here for being with us today. We can go on to the next slide. More specifically, we're thrilled to welcome many of the over 210 people who registered for today's summit. And reflecting our Rutgers hosting, just over half of the registrants are from New Jersey, but we also note that 15% of registrants are from outside of the United States. So truly, we are so pleased to welcome you all and express great gratitude to my colleagues here who are going to present their fantastic work. So with that, I'll turn the screen over to our colleagues in Ohio. Holly and team, take it away.
Thank you so much. Let me get this going. There we go. Hi there. My name is Holly DeBelco-Shoney. I am a professor and also the director of research for the Age-Friendly Innovation Center. Deepest gratitude to Rutgers and the Hub for Collaboration and Aging, Natalie and Emily, for the opportunity to talk about our work today. This work is focused on the role of mobility managers and the opportunities for age-friendly communities to look at synergies with the work that they do. Through our work, one person described mobility management managers as matchmakers of resources and influencers of change. That really resonated with our research team. I'd be remiss to not point out my colleague, Phoebe Alabach, who has been a critical lead in this project. I'm going to talk a little bit of background about who we are, this issue, talk about mobility management, study description and findings, and where we're going next. So I'm part of the Age-Friendly Innovation Center, which is a center of Ohio State University's College of Social Work. And our goal is to improve social built and service environments that support the livability of folks of all ages using evidence-informed initiatives. Part of our work, we have a technical assistance program that is generously funded through the Health Path Foundation, in which we bring together current folks who are part of the network, as well as other interested communities for discussions during monthly office hours. We also offer age-friendly certificates to help really launch folks into the network with, of course, many of the resources that AARP and others provide. If that's something you're interested in, our website is listed there. So we are aware that there's a need for more evidence-informed, age-friendly practices. We also know that we often live, work, and play in different geographic areas. Sometimes those areas align with the geographic areas of your age-friendly communities and initiatives, and sometimes they cross those boundaries. Transportation is a critical age-friendly community domain. Our team has been very interested in looking at alternative transportation options, as the majority of us, certainly in the Midwest and many other places, prefer to drive our private vehicles. And even though often we're in positions where we're not able to do that for a variety of reasons, we really need to look for different ways to get to where we need to go to meet our daily needs and have socialization. Mobility managers are sort of the people infrastructure that provides that type of support. For those of you not familiar with mobility management, two key roles: connecting people to transportation options, as well as working across sectors to support new services. The focus of the work is on older adults and disabilities, and the majority funding comes from the U.S. Department of Transportation and the FTA, as well as local match funding for these positions. There are 14 states that have statewide mobility management programs that you can see in the purple here. Ohio's unique in that 66 of our 88 counties are covered by mobility managers. There's great opportunity of alignment and synergy between the goals of mobility management and the transportation objectives of age-friendly communities. I'm going to talk about one specific study, a mixed method study, in which we explored the role of mobility managers that they play in regards to alternative transportation, as well as identifying barriers to accessing, understanding where riders go, with the hope that our efforts will then provide recommendations to the Ohio Department of Transportation based on what we learned. I mentioned it was a mixed method study. We started first with a statewide survey. I'm going to report some of those results today. Then we conducted in-depth county-based case studies for 4 very different counties in our state, some of which that have age-friendly communities, some that have mobility managers, some that have robust alternative transportation options, and others that do not. That's going to be followed by community engagement studios that we're in right now, where we're doing problem solving on the ground with local providers. And then, of course, our dissemination and recommendations to the state and the community. So our statewide survey that we deployed looked at the role managers play, some of the challenges that they face, what are some of the common destinations of the folks that they serve, and what are those alternative transportation options in their community. There are 39 mobility managers in the state that we reached out to. We got 27 completed surveys at about a 69% response rate. As I mentioned, we also conducted 4 in-depth case management, my social work background, case studies of these 4 communities. We looked at existing documents like their coordinated plans, their age-friendly actions plans if they existed, to have a full understanding of what are those options and goals and strategies in that community. We conducted 12 interviews, 3 per county, also ran focus groups specifically with older adults, and tied our work with existing transportation committees. We found that almost half of the mobility managers had not received training in mobility management in the state of Ohio prior to taking on their positions. About a fourth were in their first year. And though many spoke about resource limitations, both in community and for themselves and their work, 85% of our mobility managers said they are motivated to stay in their position because of the impact that they're making in the community. Core functions of mobility managers were around establishing and continuing these TACs, these advisory committees and groups in the communities to address transportation issues. And then certainly advocating, raising awareness about some of the realities that many residents, many older adults, and people with disabilities face in trying to get to where they need to go. A lot of conversation about cross-region collaboration that was really critical in having to get folks often cross service areas, counties, to get their needs met. We learned that there was a pattern of having older people and people utilizing services that were available that didn't always match with what was available. So, for instance, non-emergency medical transportation, the mobility managers reported that, yes, they have those things available in their community, but there was lower use. And that really is the case across all different modes of transportation. And we also saw that in suburban or urban and rural communities. Many limitations of alternative transportation used by older adults that really spoke to service limitations when they offered the services, how you access the services, as well as the insufficient coverage in certain areas. And so when people want to go or need to go to an appointment, there may not be services that are running. There may not be availability. The timing may be off. Having to plan ahead of time to access those services are all things that were identified. Most commonly, individuals reported that the folks that they worked with were going to medical doctor's appointments, followed by grocery stores, working and volunteering, and then receiving social services. And in our community, almost half were going to areas outside their county area. We have sort of hubs of medical services throughout our state. And many individuals living in rural communities have to travel to more urban areas in order to receive their needed medical services. Kirshner and Silverstein were credited for identifying 5 A's of age-friendly transportation, including availability, accessibility, acceptability, adaptability, and affordability. So as we reviewed our qualitative data, we were able to see comments made by mobility managers that reflected these A's. In addition, what we learned was the importance of adding awareness. So though there were some limitations around availability, accessibility, acceptability, adaptability, and affordability, this disconnect between when there are indeed services available in the community, but people are not aware of them or know how to access them, our data really supported adding a 6th A to age-friendly transportation. So our emerging recommendations from our findings the importance of investing in this social infrastructure, these networks that support coordination, awareness, and navigating different barriers. We really need to think about new ways to address cross-county transportation and regional approaches. I mentioned the awareness gap. And then finally, opportunities for collaboration between mobility managers and age-friendly community leaders. Very similar goals and objectives. And so how can we capitalize and work together to support more age-friendly transportation in all those communities? So, as part of that, we are a part of a coalition of age-friendly communities in the state of Ohio. We actually are now up to 50 states. Bill will probably, or 50 communities rather. Bill probably can give you the exact number, but we are really growing. And so, the importance of sharing these local looks for understanding, sharing best practices in understanding, and transportation is one of them. But we use this group, we meet quarterly, and then we also meet in person once a year to share our learnings within the unique context of the state. So this work was supported by the Ohio Department of Transportation. We're very grateful. I think one of the special things about age-friendly work is that there are lots of different places to look for support for the work that we do outside of some of the traditional aging funders. Encourage you to reach out to us. You can find us on our website as well as on LinkedIn. And then, of course, please email me anytime, and I can also connect you with Phoebe as well, who led this work. So thank you. That was a quick run through, but now I am going to go ahead and pass things over to Dr. Shong, who is going to talk from Penn State, talking about, are we making progress for planning for aging with Dr. Warner. So Dr. Shong.
Thank you, Holly. And it's my great pleasure to present our empirical study. So in this research, we want to look at from the perspective of urban planner and local government official. And we're asking this critical question, planning for aging, are we making progress? And in this research, I collaborate with my colleague, Dr. Mildred Warner from Cornell University. So as we all know, aging is a national trend in the US. As we can see on the map on the left, almost 47 out of 50 states have older adults, more than 15% of older adults. And on the right side, we can also see that there is increasing movement of the age-friendly communities. As a map from the ARP, it shows that I think more than 1,000 communities has joined the ARP age-friendly network. So our study is actually built on this framework, as people for all ages should have full capacity in enabling environment. But from a physical perspective, as people age, their average capacity increase as you learn how to walk, bike, how to drive. But as people age, we can see that average capacity has been decreasing. So how to fill the gap? That is where the local government, the urban planners can come in. That is also our research focus. So we look at how to use inclusive design, how to provide formal and informal services to fill the gap. And we also pay attention to the important role of multi-generational planning. As a result, in a perfect world, we want everyone, no matter how old they are, how young they are, they can reach their full capacity in enabling environment. So in this research, we use two national level data sets. The first set of data set, we collaborated with ICMA to send national surveys to local government officials to survey their attitude, actions, barriers, motivations to planning for ages. And we collected the survey for 3 waves. Our initial survey is from 2013. And we're able to get the survey before COVID in 2019, as well as after COVID in 2023. That's well the work I will present to show are we making progress. And another part of data we are using is through the collaboration with ARP. We look at their livability index, which is built on the age-friendly domains from WHO. And we are able to get the data for 2 years for the last decade, 2015-24. We want to look at is joining the ARP network will make a difference on the different aspect of age-friendly. So the first part is a brief summary of the key element we measured in the planning across generation surveys. We look at the role of urban planning, like if the community plan take attention to the need of not only older adults, but also children and women. Then we also look at if the zoning support age-friendly environment, such as if the community covered by zoning code that support workability, to support mixed use and housing affordability. We also measure local government's barriers, motivations, and attitude towards building age-friendly community. And we specifically pay attention to the social layer. We look at civic engagement. If the family with children use senior engaged in planning for their need. We also look at this important factor, cross-agency partnership, if government collaborate with each other to provide services, to provide information, or have joint use services with school. And at the broader community scale, we also look at age-friendly services, the number of formal, informal mobility services provided in community to support people healthy aging and aging in place. And also the importance of built environment, percent of community covered by, for example, pedestrian-friendly street, if there's a playground within half a mile, and if there is multifamily housing. So for the first part of word, there are some key takeaways for that. And what we found, building age-friendly communities, what lead to change? As we can see in this figure, we find the importance of engagement of senior with children, the importance of leadership as well as professionalism. They form the transformational leadership, which lead to policy change. So communities' plans will pay more attention to the need of aging and children. And with a more supported planning environment, it leads to a better zoning code. And as we can expect, better zoning code leads to better built environment and broader housing choices. And for the importance of cross-agency collaboration, if government collaborate with each other, it's going to provide more services for children and older adults. And let's come back to the question, planning for aging. Are we making progress? So in this study I'm going to present is using the national survey from 19 to 23, which cover the important COVID-19 period. And in this research, we look at number of services for older adults. Based on the survey, I'm not going to through all the detailed items here, but we were able to measure formal services, such as senior center, mobility services, such as ADA transit, and informal services, like social activity and recreation programs. And a not very exciting news here is that on average, we found that the number of services provided dropped from 2019, which on average about 12 number of services to 10 in 2023. So in this research, we want to look at what factors are associated with services for older adults, like what factors really matter for community to provide more services to support healthy living and aging in place. Does COVID-19 motivate change? We all know that older adults are very vulnerable during COVID-19. Will the community recognize the need? We also ask, did social division reduce change? based on our survey from 19 to 23, we do see an increase in social division from the survey question about is the community more divided by income, class, race, ethnicity. And we are also interested in institutional action and ask, did join AARP age-friendly network matter at the state level? Then we are using this multi-level government framework to look at local political content on age-friendly community. Does local leadership and priority matter? We measure cross-agency collaboration, the number of agencies collaborated to deliver services to meet the need of older adults and children. The engagement of older adults in planning for their needs. We also ask local government officials and urban planners their professional motivation in planning for older adults. And in the 23 survey, we also add a question to ask ARPA Fund for older adults and the Conservative Governing Board. And we also want to look at, does community characteristics matter? Well, the capacity, the need from older adults, and mental status, race, ethnicity, well, these characteristics matter for services for older adults. Now let's look at the result. If the bar is on the right side of the y-axis, it means it's positively related to more services. And if it's on the left side, it's negative. And we find public health crisis doesn't really matter, but we only use the ear dummy in this analysis. We do find that societal ageism, the increasing of social division related to fewer services, as well as rural and suburb-like in services for older adults compared to urban area. So what factors can drive the change? We found the importance of institutional action, the state joint age-friendly network. We found the importance of local government motivation, the importance of social layer, the engagement of older adults, and cross-agency collaboration. And community need and capacity also matter, lead to more services for older adults. Now let's look at what do the AARP livability data show. So based on the WHO age-friendly cities, AARP create indicators to measure different aspects of age-friendly community. And if you're interested, you can go to their website, put on your address. Then you will get a sense of how livable your community is. So based on the livability index score from 15 to 24, we're asking, what do the AARP livability data show? And although there's more than 1,000 members now, based on the data limitation, we're only able to match about 733 age-friendly network members. And we compare their livability to the non-member community. And we're asking, do the member community experience greater improvement in livability from the last decade? And are the member community more age-friendly than non-member communities? As we can see on the right side of the figure, we see this dramatic increase in the members since 2012. So for the first question, do the AARP friendly network members have greater improvement for the last decade? And this is a comparison within those members. And we do find that it makes a difference. The AARP age-friendly network communities improved overall livability over time. And we also see the improvement in almost all the aspects of the age-friendly domains, except the health remains stable. And another question is compare between the member community with non-member community. And we're asking, are the member community more age-friendly than non-member communities? And as we can see in this figure, if the bar is on the right side, it means the member community perform better than the non-member community. And if it's orange bar, it means the data in 15. And if it's blue, as the data in 24. And we can see in general, AARP age-friendly network communities are more age-friendly, especially in the community physical built environment, such as neighborhood transportation, housing, as well as health. And by looking at both years, we can see that the advantages persist over time, although we do see a little decline in health. And what really intrigued us and we found interesting is the biggest gain is in the social engagement. We can see in the orange bar, the AARP member communities lag in 2015, but there is a big jump in 24, highlighting stronger social connection and inclusion. And in this slide, by summarizing our research for the last decade, using the national level data for 3 waves, as well as AARP data for the last decade, what we found is support an aging population require institutional action. It requires the engagement, maybe the engagement with AARP network, with local professional motivation, engaging the older adults and the children and youth in planning for their needs. All of those are important factors to support aging population. We also found age-friendly is driven by engagement and cross-agency collaboration, and this local ecosystem for age-friendly. And we do need a broader government approach, a multi-level age-friendly ecosystem. So this is our updated framework. From the individual level, provide an enabling environment for reach full capacity. Now we are presenting this donut figure to show the interaction between different levels. In the macro level, individual level, we want to support everyone healthy living and aging place. In the meso level, we want to build this age-friendly community to have all the different aspects of age-friendly domains. And in the microsystem, age-friendly state policy, and important factors to connect all the different levels at the social engagement, cross-agency collaboration, which we found very robust result in our research. And it can increase the services provided to the aging in place, but we also need to caution about increasing social division and ageism. And if you're interested, please check out our research. And now it's my pleasure to turn our attention to Rutgers group to talk about older adults' strengths as leaders of age-friendly community.
Great. Thank you so much for that rich presentation. I'm so excited for our discussion time to talk about all that's been presented and happy to have our term as the Rutgers team here. So again, I'm Emily Greenfield. I'm a professor at the School of Social Work and also director of our Hub for Aging Collaboration. And I'm going to lead in the presentation of our team's work alongside Natalie Pope and Uri Amir-Koren as part of our age-friendly research team on older adult strengths as leaders of age-friendly community initiatives. Next slide. Great. So if we step back and think about what programmatic guidance is there for communities who aspire to go on their journey of making their built social and service environments more inclusive of people as they age, kind of think about what are the key elements of that program theory. And we can appreciate that older adults' participation, that older residents themselves should be involved in these efforts, is an explicit part and long-standing emphasis of the program theory for age-friendly community practice. You can see in the foundational guide from the World Health Organization back in 2006, 2007, that they had focal language about the importance of involving older people as full partners at all stages of community change, explicitly mentioned as part of this formative guide for the entire movement. And here in the United States with AARP, to enroll in the network, to get on the map as a community as part of the AARP age-friendly network of states and communities. The application question doesn't ask for too much, but it does ask focally, how will older adults be involved in the community's efforts to become more age-friendly? So our team, using the tools of collaborative research alongside age-friendly community partners, has been working for years to advance the empirical science and theoretical understanding of this aspect of implementation. Why is it that we want older people involved? How are they involved? And how can we be more intentional in implementing that part of the program theory? So we'll go to the next slide. So just for a high-level overview, we have 3.5 papers written on this topic, and we'll share the presentation slides, and you can go ahead and peruse this prior work. But for the purposes of today, we're going to present our newest paper, which is currently under review for publication, on older adult strengths as age-friendly community leaders. And we put the LinkedIn QR code for the hub as well. So eventually the paper will come out and we'll post about it on LinkedIn and people can stay up to date that way as well. So we'll go to the next slide. So the focal question of this paper is, what strengths-based qualities do older adults bring to leading and supporting the implementation of age-friendly community initiatives? And I'm going to present 3 slides that kind of give a brief conceptual, theoretical, empirical background on how we came to this question and how we went about being sensitized and using data to explore it. So next slide. So the first focal concept to understand is what we mean by age-friendly community implementation processes. You know, the age-friendly universe is vast, and age-friendly is a term that's used in a lot of different ways. For the purposes of our work here, we're really focused on the doing of implementing. You have these high-level aspirations of what an age-friendly community should look like, what it should feel like, how it should be characterized. But we're really interested in, like, how do you go from that aspirational vision for communities into actual outcomes and systems impact? And we think about implementation processes as being that intermediary piece. It's the broad set of activities among diverse community actors to translate the aspirational values of an age-friendly community into programmatic activities, outputs, outcomes, and impact. Next slide. So in the age-friendly literature on implementation processes, there is widespread recognition that it takes a mix of a lot of different types of resources. You can't just like have the hope of an age-friendly community and then it becomes, right? You need actual resources mobilized in intentional action with each other over time to create change. And of the many types of resources that are used and leveraged for age-friendly progress, people really are a critical resource for age-friendly community implementation. This is a quote from Formative Scholarship in Implementation Science that emphasizes more broadly the importance of people in implementing interventions for change. It reads, "People are not passive recipients of innovations. Rather, they seek innovations, experiment with them, evaluate them, find or fail to find meaning in them, develop feelings about them, challenge them, worry about them, complain about them, work around them, gain experience with them, modify them to fit particular tasks, and try to improve or redesign them, often through dialogue with others." Next slide. So our exploration of how older adults as a potential people resource contribute to age-friendly community implementation was grounded in 3 key areas of theorizing, which I'll now summarize briefly. So first, we drew on the notion from disability rights concerning nothing about us without us. This idea is about the substantive inclusion of people who are marginalized in decision-making related to their interests. It extends to older adults' participation as age-friendly community leaders, especially in the context of ageism, a characteristic of society that advances stereotypes and discrimination against older people that would relegate them otherwise as powerless and without agency. So on that note, we further drew on ideas from reframing aging as part of contemporary campaigns against ageism. We were especially motivated by the frame of aging as, quote, gaining momentum, this idea that aging is an accumulation of years of life that can yield growing wisdom and motivation for good work. And finally, we were broadly sensitized to the literature on the qualities of older adult volunteers, including empirical findings that older adults on average tend to commit a greater number of hours to volunteer work, are more agreeable to volunteering when being asked, have longer term durations as organizational volunteers, and express greater altruistic motivations for volunteering in contrast to more instrumental purposes. So collectively, these were our sensitizing concepts that we brought to our analysis of qualitative data, which I'll hand the mic over to Natalie to explain further.
Great. Thanks so much, Emily. So yes, so this study is a secondary qualitative analysis, meaning that we explored a new question of previously collected data that was conducted by members of our team. So the parent study broadly explored ways that a multi-state sample of older adults in the U.S. describe participating in age-friendly implementation. Our team conducted 22 in-depth qualitative interviews with 23 participants in the spring and fall of 2021, and we really sought here to talk to individuals who are participating or leading and really driving their age-friendly initiative in their localities. So the sampling approach for the parent study occurred at two big levels. So first, we sampled age-friendly initiatives in geographies where initiatives broadly shared similar organizational features. So like a cohort of grant-funded efforts or where initiatives were broadly more characterized by grassroots volunteers. And we conducted sampling here in New Jersey, Maine, Kentucky, and Pennsylvania, shown on the map on the right. We then worked with contacts in these geographies to recruit eligible individuals from initiatives in those areas. Across these four states, our sample, as I mentioned, included 23 participants spanning 15 initiatives. Participants had been involved in their initiative for about 5 years on average at the time of the interviews, and most participants were white, female, and well-educated. We used reflexive thematic analysis to analyze the secondary qualitative data. Glad to talk more about this if anyone has questions. We familiarized ourselves with the data and had 3 iterative rounds of coding and subcoding, along with analytic memoing. All right, back over to my team for results.
Great, thank you. So I'm happy to kick off the presentation of our results, which, heads up, spoiler alert, there's going to be 3 thematic categories that we found on the strengths that older adults bring to their age-friendly work. So next slide. So the first thematic category refers to older adults' knowledge of aging in the community and how they leverage that knowledge to advance the aims of an AFC initiative. Oftentimes, this knowledge of the community was developed in the context of older adults standing as a longtime community member and past professional and life experiences. Using this experience, participants further describe their capacity to teach others in their community about aging-related issues based on their own lived experiences of aging. For example, one participant described putting on community presentations about aging designed for younger residents to encourage them to plan for their own future selves. Oftentimes, in the context of their long tenure in their communities, participants further express their understanding of the particular challenges facing older adults in their communities. An advisory committee member, age 74, shared, quote, "It's one thing to read books and studies and see what's in print. It's another thing to see what your neighbor is struggling with and to come up with ways then of taking what one neighbor needs and saying, well, do other people have the same problem?" An additional type of community knowledge that participants brought to the initiatives was their knowledge of and connections with people and organizations. Several participants described how their long tenure within the community afforded them knowledge of key individuals to engage for advancing the strategic priorities of the work, like personally knowing the mayor or being aware of local funders. The quote on this slide demonstrates this sub-theme from a 92-year-old age-friendly community advisory committee member who lives in a local senior housing building, describing how they help share information from the initiative throughout their networks. The quote is, "I know a lot of people in the building, and if it was something I thought they should know or would like to know, I would tell them." Next, I'll turn it over to Uri for the second thematic category.
Thanks, Emily. So our second thematic category is specialized skills and abilities. A key finding here is that age-friendly older adults leaders didn't just donate their free time, they brought decades of accumulated professional and civic experience with them. We think of this as recycling professional talents, applying expertise built long before the initiative to tasks like improving operations, writing grants, launching programs, and running meetings. We identified 3 common, potentially novel skill types across the interviews. The first is volunteer management and board development. The quote in the screen captures this well. A 70-year-old former teacher shared how she uses her background to ensure volunteers are placed in roles that are personally satisfying to them rather than burdensome. That demonstrates strategic, people-centered leadership drawn straight from her professional experience. Second skill is integrative thinking, the ability to see the bigger picture. Older adults leaders understood how different components such as housing, transportation, and social services connect to each other and how their local initiative fits into broader networks and age-friendly systems. Finally, entrepreneurial skills. The older adult leaders were not just planners, they were builders. They spotted local gaps like the absence of social programming or home repair services, or even the lack of an age-friendly initiative altogether, and created solutions from scratch. They had the capacity to turn ambitious ideas into sustainable realities. Back to you, Emily.
Great, thank you, Ori. So I'm gonna go over the final thematic category. Everybody can hear me, right? Okay, just wanna. Okay, so the final thematic category refers to alignment between the AFC initiatives with the participants' own personal values and life philosophies. This value congruence undergirded many participants' strong commitment and motivation to participate and to sustain their involvement as leaders. We explored this thematic category in terms of two sub-themes. The first being the great value that older AFC leaders place on their peers and their community. Many participants connected their own identities as both an older adult and a longtime community member to the work of being an AFC leader. The quote on this slide demonstrates this, an 80-year-old work group member who shared the deep meaning of their civic pursuits through Age Friendly relative to their other community involvements. They stated, "I'm more involved in the Age Friendly initiative with my whole being because I can identify with the needs and what we're doing." The second theme, which was very prominent in the data, referred to the participants valuing the psychosocial opportunities of participation. Some participants almost described this aspect of value congruence like an attachment to the work, a deep motivation and connection to engage with it because of how it fulfilled them psychologically and existentially. Much of this was framed in terms of the initiative serving as an outlet for generativity and altruism, contributing to the well-being of others, to all people who are aging and living in their communities. Relatedly, a few participants expressed this sub-theme in terms of feeling of time running out for their own lifetimes, which fueled a commitment to spend the time they do have on high-impact, mission-driven work, such as through the Age Friendly initiative. So I'll hand it over to Natalie.
Great, thanks so much. Yes, so here's just a brief overview of our findings, but for the sake of time, I'm going to go right into kind of our discussion points here. So we position our findings really in two theoretical framings. First here, we kind of point us to a human capital perspective, which encompasses the knowledge, skills, and abilities that people draw on to produce and create things of value. And really kind of by name, our findings of knowledge and skills and abilities really line up quite well with this framework. However, there's this category of values congruence that not always, but often human capital theorizing does not encompass. And so we had to face, well, how do we fit values in with this framework that we're putting together? And this put us into a developmental strengths perspective, which allowed us to more fully and holistically blend the capacity for production along with personal values, supporting community change and pro-social actions. And I'm very glad to go more into depth with this, and especially in the chat and later on in the breakout rooms. But these were our kind of two main constructs here.
Okay,
Back
and
over to
just to
Emily.
close this out for practice implications, we're excited about the pragmatic implications of all this rich theorizing in terms of helping with volunteer management and cultivating older adult civic leaders as partners, if not leaders of this work. So our findings would suggest don't value older adults as leaders just because they're around or just because they're presumed to be available, or like, oh, this is great for them because I want to stay active. I would say those kind of framings, implicit ageism and assumptions about older adults, our findings really showcase best practices around engaging with older adult leaders in ways that position their strengths as mission critical actors in age-friendly community initiatives, and really trying to understand what dimensions of these strengths they embody and are wanting to give, and matching that with more intentional opportunities for that to be manifested in age-friendly co-production. I think we'll go to the next slide and skip over that for the sake of time and just say thank you to everyone. We appreciate your interest in this work, looking forward to the discussion. And with that, we'll hand it over to our colleagues from the University of Massachusetts, Boston for our final presentation. Thank you.
Thank you very much. Right. Alrighty, so hopefully everybody can see that. So first and foremost, I am honored to be here today and to speak about spillover, and close out this webinar amongst the presenters I consider to look up to. And I would also like to thank our funder, AARP International, for funding this work. Dr. Caitlin Coyle, and Sheena Gleason, who unfortunately isn't here, but who collaborated on this project. We collaborated on this project together. And of course, um, Emily and Natalie for the invitation to speak today. Um, so getting into our work, AARP International pursued this work in order to determine the utility of spillover as an evaluative mechanism. So in other words, to provide a more real-time way for countries to report the impact of their work and strengthen its value on a policy and advocacy level. So as you can imagine, multi-sectoral and multi-level work like that of age-friendly communities can be incredibly difficult to measure in traditional ways. However, we did set out to start this project with two research questions in mind. So first, does the concept of spillover translate into global age-friendly contexts? And what are the ways to document and measure spillover? So before I can get into our process, I need to discuss with you all the true inspiration behind the spillover assessment project. So Caitlin will be able to speak more to this, but back in 2020, Caitlin, Sheena Gleason, and Jan Muchler wrote an article for the Gerontologist documenting that there are these positive, unexpected benefits arising from the age-friendly work being done here in Boston. And so
Hello.
these positive,
What's
unexpected
up?
benefits. Oh, okay. Hope I'm okay. So these positive, unexpected benefits are spillover effects that are integral for the sustainability of a community's age-friendly work. So essentially, the sustainability of age-friendly initiatives is enhanced by spillover, whereby a behavioral or policy change in one environment spurs change in another environment. And this word spur is very important to cling on to here because spillover gets at this idea that authentically age-inclusive environments require not just the continuation of an initiative, right, but that its principles become embedded in many areas beyond the network and beyond those just focused specifically on older adults. So these seminal findings are what led AARP International to want to create a tool for communities to capture their work's broader impact. And actually, those of us on the team actually consider what we created to be more of a guide rather than a tool, because our whole purpose was to help leaders understand, assess, and amplify their own spillover. So the overarching goal of our project was to support the age-friendly global network in an evaluative capacity. So again, understand, assess, and amplify their own work. To do so, we aim to create an empirically sound and theoretically grounded conceptual model of spillover in our first phase, phase one, to pre-test preliminary components of our guide with global age-friendly leaders to ensure global applicability in phase two. And lastly, we defined and refined our guide by seeking further global input in phase three. So in order to achieve our aims, we utilized a number of data collection methods. So we conducted a literature review and environmental scan when creating our conceptual model. During our pre-testing, we sent surveys to age-friendly leaders and held interviews with age-friendly country affiliates to ensure the usefulness of our guide. And after we drafted our guide, we then solicited final feedback on the draft from the same age-friendly country affiliates that we interviewed in the prior phase. All right, so getting into phase one, our literature review and environmental scan were critical for the guide development. We wanted to understand how other disciplines conceptualize spillover, how age-friendly literature and progress reports were documenting the impact of their age-friendly work. And through this understanding, we were able to identify the foundational components, or kind of ingredients, if you will, of spillover that can apply to the age-friendly context. We took an inductive approach to our literature review. So when looking at age-friendly literature, we zeroed in on papers that looked at benefits, impacts, and systems change, among other keywords. And when reading about spillover in other disciplines, we sought to understand spillover through an interdisciplinary lens. So we looked at papers that focused on spillover in the environmental and intervention workspace, as well as health policy. Moving on to quickly our environmental scan, that consisted of 44 progress reports with representation by size, setting, and geographic location. Right, so moving on to what we found in phase one. Spillover in other disciplines describe that there is this unintended effect outside of the targeted audience or outcome, and that this effect can occur either indirectly or directly. Researchers note that spillover varies by mechanism, suggesting there are different pathways that determine how and why outcomes occur. And importantly, spillover involves this exchange of energy between two identities or domains, indicating that there needs to be something that kind of kickstarts the actions that lead to something unintended. So, what we found during the age-friendly literature side of our review was that much of the work has focused on early outcomes of community initiatives. And these outcomes can be seen, of course, as building blocks of spillover, but the field has not gone as far as to describe how these outcomes occurred and how the outcomes led to sustainable changes in the community. So after the literature review, the team came up with a conceptual model, which I'll show a little bit later on because it was quite an iterative process, and our second phase actually helped us refine it. But the review of progress reports in our scan kind of reinforced the idea that the foundational components we identified through our literature review were being documented in these progress reports, but just not explicitly so. So the reports laid out what communities were doing and more broadly, how the work spread, but the process was less detailed and their impact was left out. So for instance, in one example, the goal of more housing for people with moderate incomes led to a home modification program for older adults in the community. And in another example, a hospice training for volunteers led to a neighborhood-based volunteer hospice support program. So we don't quite know the impact of these examples. We can certainly infer, but again, we don't quite know the impact of those of what occurred. So moving on to phase two, this included global pre-testing of the foundational components. So right, again, these ingredients of spillover that we identified. We also sought out how familiar global age-friendly leaders are with spillover. And this phrase helped us identify what types of activities and information would be most useful to community leaders. We had an international sample of age-friendly community leaders who shared how and what kind of activities and information could be most useful to them through our survey portion of this phase. We then conducted interviews with 15 age-friendly country affiliates from a diverse range of countries. These interviews were intended to walk an affiliate through our spillover model and have them identify their own spillover, obtain feedback on these components, and understand the usability of our core activities of the guide that were discussed in the survey portion of this phase. Speaking of our survey portion, so our survey told us that how to identify spillover, how to measure spillover, and ways to amplify and communicate their own spillover were important pieces needed in our guide from the perspective of community leaders. Another interesting finding from this survey was that 59% of respondents said they were seeing spillover. So they're seeing these unexpected positive benefits arise from their work. And so that was really exciting. What was even more exciting, though, and in terms of my own opinion, but the interview part of phase two was kind of the place where we really saw those hours upon hours that we spent on the conceptual model lead to a click in the minds of these country affiliates. It showed us that the guide also serves more as a tool rather than a task to complete. And that's when we realized we were making more of a guide and not so much an analytic tool to measure spillover. We did have to make some tweaks to our original draft, and that's why I said the process was very iterative. So countries like Wales and France took a more fluid approach to our age-friendly work, or to their age-friendly work, whereby spillover is built into their process rather than viewed as something kind of external or an external outcome, demonstrating to us that cultural and linguistic translation of the guide is needed when disseminating it. And finally, these interviews, like the survey responses, emphasize that demonstrating impact is essential for the sustainability of age-friendly work. So one interviewee said, demonstrating these spillover examples could be useful from a funding standpoint, while another said they could be useful from a reflective and forward-looking view of their initiative's work. All right, so this might be the moment you've all been waiting for. So through the literature review and environmental scan and our interviews, we say that an age-friendly community activity creates this exchange of energy or spark that spurs action in someone, an agent, who thinks I could be doing something more, and uses their resources, which could be things like funding, it could be media, marketing, etc., that then creates this pathway towards age-friendly spillover. And this pathway then leads back to those mechanisms for different outcomes that we found in the literature review. So depending on the agent, their resources, and their resources, pathways to spillover could be through changing societal attitudes, influencing policy, shaping partner work, things like that. And we're happy to talk more about that too. So one of the best examples we got was from an affiliate in Sharjah, and this person described how after the launch of an award for the elderly, local media and social media outlets featured the award, families and community centers began to recognize the value and capabilities of older adults. Now older adults lead various workshops across their community. Quickly getting into phase 3. So finally, our last phase, phase 3, included the same interviewees, just 2 less from the previous stage, who gave us feedback on the guide after they reviewed and applied the guide to their own work. That Sharjah example actually came from this phase. And what we learned is that we needed to clarify our instructions. We needed to include an FAQ section for lingering questions, and that the variety of cultures make our word choice critical for interpretation in terms of how we interpret the model and so on and other components of the guide. And so just bigger takeaways, spillover isn't just a process to get to unexpected positive benefits. It's also a lens for demonstrating impact by showing how an age-friendly activity can spark broader systems change. Spillover is also happening all around us, even if those instances haven't yet been documented as so. And in some countries like Wales and France, they have more of a high context approach to their age-friendly work, and it's embedded already in the community, and that spillover isn't seen as something they expect. Spillover is seen as something they expect to unfold in their age-friendly work. And so as we've learned, there are many pathways to spillover occurring across and within ecosystems, disciplines, and fields, all kind of leading to this larger web of age inclusivity. And so with that, I'd like to thank you all for attending, and I'm eager to answer any of your questions.
Thank you so much. So happy to pass the mic along to Bill Armbruster with AARP to moderate our discussion portion.
Thanks, Emily. Again, I'm Bill Armbruster. I'm the program manager at AARP Livable Communities, and I manage the AARP network of age-friendly states and communities. And I saw in the chat someone's like, oh, AARP just hit 1,000 communities. We actually hit 1,046 this week. So the network is growing. We've got 38% of the US population lives in a community that is enrolled in the network. And that's everything from Hart's location in New Hampshire, that's population less than 100, all the way up to New York, LA, Atlanta, and everything in between. And the network, actually, about 40% of the network is communities of a population of 25,000 or less. So we see this model works for every size community. And I have to just say, wow, what great research coming out from Ohio State University, really looking at taking the theory and movement of transportation on moving vehicles to mobility management on moving people, having that shift of conversation that really makes it more user-centric. The work coming out of Cornell and Penn State, looking at how communities that are enrolled in the network are outperforming, showing this framework that works. Rutgers with the importance of volunteers. And I love that statement. It's not just about filling a volunteer spot or getting volunteers to do tasks, but really embracing everything that volunteers can bring, the power they bring and what they bring to moving age-friendly communities forward. And then last but not least, looking at spillover. I think this has been really an underlooked at aspect of age friendly, because you are engaging people, you're engaging partners, you're engaging the community. And once they hear about age friendly, it is that spark. You can't unhear that. You can't say, oh, I don't want to be age friendly. I can't think that, this should work for people across all ages and abilities. And then when they do go back, they're looking at their own policies, they're looking at their own programs, they're looking at their own resources. So we do have a couple questions online to address, but I also want to remind folks there will be breakout sessions afterwards. If you want, you can go in any of the breakout rooms, talk to any of the groups of presenters that were there if you want to go a little bit deeper on anything. But my first question, and I'm going to leave these open to all of our speakers, is a statement followed by a question. The number one financial risk for millennial workers is cost of care for their parents. Wondering if this is part of anyone's research and conversations with employers and/or economic development professionals. How is that multi-intergenerational and caregiving lens being brought into your work or conversations? And just feel free to answer.
I can jump in. I mean, I put in the chat in response to this the recent work that was funded by the Hartford Foundation and uses the same nonprofit that our colleagues from Penn State and Cornell work with in terms of conducting surveys of local governments. And it's a really interesting crossover between age-friendly communities, because local governments have been kind of centered in age-friendly community work, and then to think about them as employers and how they have a workforce of their own and embedding age-friendly principles in that element of it, I think is actually a really interesting overlap between the center of energy for age-friendly communities and the age-friendly employment and caregiving. I mean, they're all kind of dancing in the same ecosystem. I would just say, like, the starting point of like where we at least do our research on age-friendly communities is really on that meso level, on the communities as like living, breathing organism that encompasses employers and businesses, but also has local government, civic leaders. And of course, we're interested especially in the civic leaders coming from a social work perspective. So disciplinary wise, that's not like a major focus, but I do think it's interesting in the broader universe and as the movement progresses of how these pieces and threads of conversation are starting to come together, which I see as a good sign.
Yeah, just to dovetail off from Emily's comments, I think we're facing such a tight funding environment. This work has always been done on shoestring budgets, and now with changes at the federal level and for us at the local level with ARPA dollars, other kinds of resources, I think there's a really great opportunity to look at public-private partnerships and think about private employers who want to ensure that their workers are healthy and able to be productive. And many of those folks are providing care and are doing caregiving work. And so I think that's interesting to think about how might we not only engage with local government and in terms of, often in many of our communities, government is one of the larger employers, but what are those private large employers that we can partner with to think about issues of caregiving and creating age-friendly communities.
Great, thank you. I do want to make a note before I go to the last question. I think we have time for one more. Pretty much all of the wonderful presenters you've heard from today are part of a National Age-Friendly Community Researchers Learning Collaborative. Get together quarterly. I invite any academics on here who are interested and want to be a part of that. It's a greater network, keep these conversations going. So I do want to make that offer, and you can put your name in the chat or reach out to any of us and we can continue that conversation. Do have time for one last question. And I think this reminds me of something that Holly said about the A's of age-friendly transportation and sort of that accessibility piece. Someone asked about access in terms of language access, and I'm wondering if and how this played into, and I know Sophia mentioned something as well from the global learnings, if anybody wants to talk about that as well.
I'm happy to go first, Holly, if you don't mind. But yeah, so I mean, I think language access for us, what we were mostly talking about too is, we have these components, we're saying spill, this is the process to spill over, and, um, in terms of spark and agent and resources, but truly in terms of language access, how do other countries, other age-friendly leaders in other countries actually understand and take in that information? Or, in terms of language is um, an agent and how we define an agent, does that actually represent how they feel this important person would be in their context? So for us, language was very much in terms of its actual form, like how are we communicating and conveying our work to those who are actually doing the age-friendly work. And so from our standpoint, language and interpretability was very important.
We have time for one more quick response on that if anyone has anything to add. Otherwise, I will turn it back over to Emily and Natalie for closing.
Yeah, in terms of language, I think we really want to push the narrative. Age-friendly is all age-friendly. We want to provide a place not only for all the adults, but for children and working age adults.
Great. All right.
Great, thank you so much. So before we open up our breakout rooms for more conversation, I just wanted to do a few closing remarks. So another huge round of thanks to our presenters, Bill as our moderator discussant, and a special thanks to Natalie Pope on our hub team for the amazing digital tech. Zach, thanks for your IT support as well, help people get into breakout rooms. And thank you all for making the time to be here. We'll follow up with an email with materials from today. We encourage you to follow us on LinkedIn and through the Hub's eBlast list to find out about future platforms for sharing ideas and connecting on age-friendly systems change. Happy Older Americans Month. We'll go to the next slide. Just as a note, if you leave the Zoom altogether, you should get a brief survey about take a few minutes to share with us your feedback on today's event. And we won't be coming back to the main room. So you can either, if you want to move on with your day, that's great, or we can get into a breakout room to have more in-depth discussion with the speakers and exit from there. So with that, I'll ask if we can open up the breakout rooms, and you should be able to use your Zoom controls to navigate into one of the breakout rooms. But if you don't see those controls, no problem. We have support here where you can unmute and say your name and which room you want to go to, or put in the chat where you would like to be placed, and we can place you centrally from there. So thank you again so much, everybody. We'll see you next time.